Post-traumatic stress disorder or PTSD is a mental health condition triggered by experiencing or witnessing a traumatic event. It affects individuals differently, manifesting through symptoms like flashbacks, heightened anxiety, and emotional numbness. Understanding PTSD is crucial for fostering awareness, reducing stigma, and providing effective support for those impacted by this condition. At this juncture, our group will explain more about the PTSD, the symptoms, causes, and the treatment, and ways on how to cope with this disorder, and also how the social worker do to these cases.
So hello everyone, we are the group 7 and we will be tackling about PTSD or post-traumatic stress disorder. So what is PTSD? PTSD is a real mental disorder that develops when a person has experienced or witnessed a scary, shocking, terrifying, or dangerous events. So PTSD can cause a range of symptoms including arousal and reactivity. It is a feeling tense, on edge, or easily startled or having a difficulty of concentrating. Next is cognition and mood. Having negative thoughts about yourself or the world, or having difficulty remembering key details of that traumatic event. Next is avoidance. Changing routines to avoid reminded of the trauma, such as avoiding certain peoples or places. Physical sensations like experiencing sweating, trembling, nausea, pain, or dizziness. Next is flashbacks, like feeling like the traumatic event is happening again.
Post-traumatic stress disorder or PTSD, prevalence and risk factors. An estimated 3.9% of the world population has had post-traumatic stress disorder or PTSD at some stages in their lives. PTSD, like other mental health conditions, result from interacting social, psychological, and biological factors. So anyone can experience PTSD after a potentially traumatic event, but people who have previously experienced traumatic events are more susceptible. How common PTSD in children? So trauma can happen at any age. When children or teenagers experience trauma, they can develop PTSD. Certain types of trauma are more likely to lead to PTSD. Children and teens may develop PTSD after experiencing or witnessing life-threatening events like abuse, violence, disasters, accidents, war, or suicide. So, the study shows that about 15% to 43% of girls and 14% to 43% of boys go through at least one trauma. Of those children and teens who had a trauma, 3% to 15% of girls and 1% to 6% of boys develop PTSD. Rates of PTSD are higher for certain types of trauma survivors. Under genetic factors is first neurotransmitter system genes. Variation in genes related to serotonin, dopamine, and norepinephrine influence PTSD risk by affecting mood regulations, fear response, and emotional processing. Second is the HPA axis and stress regulation. Dysregulation of the hypothalamic pituitary adrenal axis impacts cortisol levels, altering stress responses and increasing PTSD vulnerability. Lastly, sex differences in genetic risk. So, hormonal and genetic differences between sexes affect PTSD prevalence, with females often showing higher risk due to variations in hormonal stress responses and emotional processing pathways. For environmental factors, first is parental mental health. Parents' mental health issues can increase children's PTSD risk through genetic predisposition, emotional unavailability, or modeling maladaptive behaviors. Second is abuse. Experiencing physical, emotional, or sexual abuse creates lasting trauma, disrupting emotional regulation, and increasing vulnerability to PTSD. Lastly is substance misuse. Substance abuse exacerbates PTSD risk by impairing coping mechanisms, increasing exposure to risky situations, and compounding stress-related vulnerabilities. Lastly is the lifestyle factors. First is high rates of obesity and cardiometabolic diseases. Poor physical health linked to stress and trauma can worsen PTSD symptoms by affecting overall well-being and resilience. Second is eating behaviors. So unhealthy eating habits such as overeating or disordered eating can amplify PTSD by impacting mood, energy levels, and stress response. And lastly is the physical activity. So regular exercise help helps reduce PTSD symptoms by promoting stress relief, improving mood, and supporting overall mental health and resilience.
The prognosis for PTSD depends on symptom severity, support systems, and timely treatment. With proper care, many improve significantly, though some may face ongoing challenges. Early intervention improves outcomes, while untreated PTSD can lead to issues like depression, substance use, or chronic health problems. Managing PTSD requires compassion, understanding symptoms and triggers, creating a safe environment, and respecting boundaries. Support professional care, encourage self-care, and provide flexibility. Prepare for crisis and offer education, community support, and positive reinforcement to recovery.
The possible consequences of stigma surrounding PTSD. First, social isolation and loneliness. Low levels of understanding from family, friends, and others. Reduced opportunities for employment, schooling, school activities, social activities, or housing. Harassment, bullying, or physical violence. We have 4 ways to cope with PTSD stigma. First, be open about your PTSD. If you live with PTSD, it's not your responsibility to change people's mind, but you can try discussing PTSD more openly if people show misunderstanding around PTSD. 2. Connect with community resources around work and employment. Addressing PTSD stigmas through conversations and education can be easier than challenging employers' preconceived notions. Assessing employment can support identity, connect with others, and nurture personal growth. Volunteer placement are often available in communities for those temporarily or permanently at work. 3. Seek therapies that directly target self-stigma. Challenging PTSD stigma involves reducing self-stigma, which can lead to isolation and self-esteem issues. So, social connective treatments such as ending self-stigma or PTSD and connective processing therapy can help combat these beliefs. Research shows ESSP significantly reduces depression and self-stigma. However, more research is needed to measure its effects. People with PTSD are not alone, and support is available. 4. If you support someone with PTSD, start by looking at your language. Language is part of shaping and expressing beliefs. If you don't have PTSD and want to start breaking down the stigma, start challenging the language you use. Words like the following skip stigmas going because they define a person by their PTSD and other mental health conditions and project inaccurate or harmful stereotypes. So make efforts to restrict their use or call them out other when you hear them lazy, nuts, addict, crazy, dramatic. Instead, try to use person-first language. Person with PTSD or person in recovery can help people with PTSD feel less stigmatized. Using person-first language when referring to people with disabilities or those in recovery. This means putting the persons before the condition. For example, instead of saying a PTSD patient, you would say a person with PTSD. The reason of this is to reduce stigma and emphasize that the person is more than their condition. It acknowledges that people with PTSD are individuals with unique experiences, strengths, and identities rather than just their diagnosis. Next is societal impacts post-traumatic PTSD. 1. Family difficulties. PTSD can make it difficult for people to relate to their family and friends, which can lead to problems in personal relationships. People with PTSD may seem distant or uninterested and may avoid social situations. This can make it hard for loved ones to feel included and can lead to feelings of hurt or helplessness. 2. Work disruption. Concentration and focus, intrusive thoughts, flashback, and hypervigilance can make it challenging to focus on tasks, leading to decreased productivity and an increase in mistake. Intrusive thoughts are unwanted memories or images related to a traumatic event that keep popping into the person's mind, and flashback are more intense, feeling like the traumatic event is happening again. Hypervigilance is a state of heightened awareness and alertness, often leading to anxiety and difficulty relaxing. 3. Social isolation. Individuals with PTSD may withdraw from social activities due to fear, anxiety, or shame, leading to social isolation and loneliness. Impact on daily life. Negative changes in thinking and mood. First, negative thoughts and thinking about yourself, other people, or the world. Post-traumatic stress disorder can significantly disrupt a person's life, causing negative thoughts, straying relationship, decreased productivity, anxiety, social isolation, and distorted worldview. This can lead to hopelessness, despair, and difficulty finding motivation or joy. Next, ongoing negative emotions of fear, blame, guilt, anger, or shame. PTSD patients often experience ingrained negative emotions like fear, blame, guilt, anger, and shame, resulting in a distorted perception of the world, vulnerability, doubt, and defensiveness. This affects relationships, work, and personal life, leading to a cycle of avoidance and isolation. 3. Feeling detached from family and friends leads to emotional detachment from loved ones, affecting relationship, work, and personal life. This detachment, triggered by emotional numbness, awareness, and fear of vulnerability, can result in strained relationship, lack of support, and withdrawal from social activities. This cycle of loneliness and hopelessness necessitates seeking professional help. Another impact on daily life is changes in physical and emotional reactions. Self-destructive. These self-destructions can take many forms, including substance abuse, risky behaviors, and social isolation. In relationship, this can lead to conflict, mistrust, and a feeling of being a burden. At work, it can result in decreased productivity, absence, and difficulty maintaining professional relationships. In their personal life, self-destructive behaviors can contribute to a sense of hopelessness and despair, further isolation them from support system. 2. Trouble concentrating. The sense of difficulty in concentrating can lead to misunderstandings, decreased productivity, errors, and feelings of isolation, affecting personal and professional activities, hobbies, and social interactions. Last, irritability and aggressive behavior. PTSD affects relationship, work, and personal life, causing increased irritability and aggressive behavior. It can strain relationships, lead to conflicts at work, and cause social isolation.
Recent research and developments, genetic insights into PTSD. A groundbreaking genetic study has reshaped the understanding of PTSD's heritability, conducted by researchers from Harvard T.H. Chan School and published in Nature Genetics. This research analyzed data from over 1.2 million individuals, identifying 95 loci linked to PTSD risk. This comprehensive genome-wide association study validates the substantial role of genetics play in PTSD susceptibility, laying the groundwork for future prevention strategies and personalized treatment plans. Also, there is another research about PTSD called Developments in MDMA-Assisted Therapy. MDMA-assisted therapy has emerged as a significant, albeit contentious, area in PTSD treatment. Initial phase 3 clinical trials showed that up to 71% of participants no longer met the PTSD diagnostic criteria after treatment. Despite this, the FDA withheld approval in 2024, citing the need for more comprehensive data due to the concerns over studies, design, and safety. This decision underscores the complex path of integrating psychedelic treatments into clinical practice, highlighting both the potential and regulatory challenges.